Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. In the sagittal plane, things that we'll be paying attention to are going to be the Achilles tendon, the sinus tarsi, the plantar fascia, bony structures, of course, and tibio-talar, subtalar joints. In the sagittal plane, that's where our focus is going to be. Let's take a look at the sagittal plane. Let's take a look at sagittal MR imaging of the ankle. So when we're moving from the lateral malleolus towards the medial malleolus, we can appreciate the peroneal tendons as they course dorsal to the region of the lateral malleolus. We can see the peroneus brevis as it moves towards the region of the base of the fifth metatarsal. And of course, we can see the peroneus longus as it moves underneath the cuboid tunnel towards the hallux metatarsal base. In this region here, we can appreciate magic angle artifact. That's artifact where signal is given off when TEs are less than 20. When the tendon is at an angle that's at 55 degrees to the main magnetic field, it can give off a spurious signal. Moving further into our sagittal imaging, we can appreciate our Achilles tendon. And the Achilles tendon is seen very well sagittally. We can appreciate the soleus muscle as it attaches to the Achilles tendon above the level of the tibio-talar articulation. If it's below the level, it's considered a low-lying soleus muscle. The Achilles tendon, furthermore, has a long insertion onto the posterior calcaneal process. We'll be searching for retrocalcaneal and retrotendon bursitis. On sagittal imaging, we can also appreciate the plantar fascia. Notice the central cord of plantar fascia as it attaches on plantar calcaneus. Moving laterally, we can see a portion of the abductor digiti minimi as it attaches on the lateral cord of the plantar fascia. And of course, we can see the abductor hallucis medially as it attaches on the medial aspect of the plantar calcaneus. And of course, the deepest structures here that is closest to the bone, that's the quadratus plantae. So that's great. So far, we've taken a look at the peroneal tendons in sagittal plane. We've looked at the Achilles and the low-lying or not soleus muscle, and of course, our plantar fascia. Let's take a look deeper into the ankle. Let's look at the space of the sinus tarsi. This is very well seen sagittally, and when we go to the most medial aspect, we see a small hole. That's the medial aspect of sinus tarsi, which then opens up into a pyramid-shaped space. And that is seen laterally. And that we can appreciate that there is no synovitis that's obliterating the fat space. We can see that also on T1 weighted images on sagittal where the fat is maintained throughout the sinus tarsi space. What lives in this space are small nerve endings that tell us where our foot is positioned in space and helps us readjust our heel position and extensor tendon constriction through ligaments and extensor retinacula that move from the lateral aspect of the sinus tarsi towards our extensor tendons. Let's get back to the T2 weighted images to see that type of anatomy. So we're seeing these are the talocalcaneal ligaments that are extending out of the lateral aspect of sinus tarsi, right? That's the pyramid-shaped portion that move towards the region of the extensor tendons through the level of the extensor retinaculum. So there are connections from inside the articulation towards our extensor tendons that help us with proprioception. So we can see that on a sagittal image. We can move through the sinus tarsi, moving towards the medial aspect of our ankle. We can appreciate where the posterior tibial tendon is going to attach onto the medial navicula. We can appreciate that here. And furthermore, we can see even going into the bony structures. So let's take a look at the bony structures on sagittal imaging. And this is where we're going to see some of our osteochondral injuries if they're present at the talar dome, at the tibio-talar joint. We can also appreciate whether or not there's the presence of coalitions, looking at the layers of cartilage that we can see 2 layers at the posterior subtalar joint here. We'll be moving towards the extra-articular anteromedial facet seen here. There is a slight amount of degenerative change in a 13-year-old patient, indicating that there is an extra-articular talocalcaneal-fibrous coalition in this patient. Moving towards the middle facet of the subtalar joint, sometimes the middle and the anterior are a continuous facet. We can see that here we do not have an osseous coalition of this location. We can furthermore look at the region of the calcaneonavicular articulation to assess whether or not there is a coalition in this location. And we can assess the bony structures of the midfoot, whether or not there's any dorsal subluxations or fractures or any kind of pathology there. Now let's take a look at some of the structures called the bifurcate ligament. That's also known as the Chopard ligament that I think you can see very well on sagittal imaging, where the calcaneocuboid, very thick ligament, and also ligaments go from the anterior aspect of the calcaneal process towards the talus and navicula. So furthermore, this bifurcate ligament, very strong ligament that is attached here, that not only supports the calcaneocuboid lateral column, but also the medial column through the connections at the talonavicular articulation. We have structures of the short and long plantar ligaments that we can see along the plantar calcaneus, and those are structures. The short plantar ligament is going to go between the calcaneocuboid and the long plantar ligament going to attach on the bases of the second to fourth metatarsals seen here. And there's a further supports of the plantar aspect, which we'll see better with even coronal imaging. So just to recapitulate what we can see on sagittal imaging, we can appreciate the Achilles tendon, any type of accessory muscles. We can appreciate the presence of bursa or distended bursa, the retrocalcaneal or the retrotendon bursa. We can appreciate the plantar fascia and its attachments through the central, medial, and lateral cords. We can appreciate the tendons and their relationship to the posterior tibial tendon as it attaches on the medial navicula. We can see those tendons coming down with clarity. The flexor hallucis longus reliably moving underneath the region of the sustentaculum talus. So that is the tendon always located under the sustentaculum talus. And then moving laterally, we can appreciate the region of the peroneal tendons and the power laterally, really appreciating that peroneus longus as it moves towards its attachment at the anterior tunnel. So we can see it move through the cuboid tunnel along the region of the inferior perineal retinaculum and tubercle and proximally. And that is your sagittal imaging. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.